Hello and welcome to HealthSpin, helping you to spin your healthcare your way. Today we're going to show you how to compare health insurance plans, something that often seems nearly impossible to do. It doesn't matter if you're buying insurance through Obamacare or trying to pick the best option during open enrollment at work. Trying to actually understand which plan will work better than another can be incredibly frustrating. Most people hold their breath, look at how much a plan costs per month, and pick the cheapest one. But if you do that, you're almost certain to lose money or not get the coverage you need. So what's the right answer? Well, there's no one right answer for everyone, but there is one right answer for you. Here's how you find it. So to help explain, let's use someone we know, Lauren, as an example. She's where so many people are when they first start out. She's lucky enough to be doing what she loves in a new city, but she must trade that off in terms of pay and healthcare coverage. And like so many 20-somethings today, has a lot more debt than savings. As far as her health, Lauren doesn't really have to think about it. If she were to go to the doctor, it would be for a regular checkup or to treat a running injury. So now that we know something about Lauren, what should she do about health insurance? Remember that starting in 2015, everyone in the United States has to have insurance or face a penalty. To be real, one option for Lauren is to not buy insurance and pay the penalty. It'd be the cheapest thing to do, that's for sure. But think about it. One trip to the hospital would probably cost as much as a year's salary for Lauren. So not an option. Instead, since the nonprofit doesn't offer insurance, Lauren will have to buy a plan on the healthcare exchange created by Obamacare. But her first step isn't logging on to healthcare.gov and picking a plan. Her first step is to fill out her medical life list. Granted, since Lauren is young and starting out, she won't have much to put into her list. But by filling out her list, she can have at her fingertips the information she needs to make the right decisions now and in the future. Step 2 for Lauren is to write down her priorities when it comes to her health care. This is really the most important step. But how should she do that? She needs to look at 3 things: her health, her financial situation, and her doctors. Let's start with her health. As we mentioned before, she's a very healthy person who isn't constantly in the doctor's office or making trips to the hospital. So she really wouldn't have to use her healthcare coverage every day. Next up is her finances. With more debt than savings, Lauren wants to protect herself against financial disaster in the event of a medical emergency. Like we said before, one emergency room trip to a DC area hospital and Lauren would likely face bankruptcy. Also, Lauren's budget is tight. After looking at all of her expenses, she figures that monthly healthcare expenses can't be more than $200. Finally, what about doctors? She just moved to DC, so Lauren doesn't have a regular doctor yet and doesn't need to worry about keeping one. So, now that Lauren has set her priorities, she's ready to log on to healthcare.gov. On the website, Lauren can begin to look at plans by clicking on See Plans and Prices. She can then enter her zip code, her salary, her age. She can then see if she qualifies for subsidy, which she does, before viewing available plans. Lauren will see over 30 plans. How can she even begin to compare? Let's start by narrowing down the field using the filters on the left. For Lauren, she'll filter by monthly premium cost. She knows she can only spend $200 per month, so let's click on less than $200. There are other useful filters, including insurance companies and programs for managing chronic conditions. But since Lauren doesn't need to consider those options, we won't be using those. After narrowing down the premium cost, Lauren now has 12 health plans to choose from. So what's next? Since Lauren is most concerned about cost, let's start with the 2 ends of the spectrum: the plan with the lowest monthly premium cost and the one with the lowest estimated deductible. Let's look at those 2 plans side by side. First, let's look at premiums, deductibles, and out-of-pocket maximums. As a reminder, A premium is what you would pay per month to have access to your insurance plan. A deductible is the most you will pay in a year before your insurance plan kicks in. And finally, the out-of-pocket maximum is the most you will pay in a year for health care, not including your premium. So looking at the two plans, what should Lauren think about? At first glance, Lauren would want to go with the low monthly premium plan, Plan 1. But wait. With this plan, she would have to pay a deductible of over $6,000 before the insurance company would start paying her bills. Plan 2, on the other hand, would start paying after she spent $3,500, which is closer to what she has in savings. So, does Lauren want to pay $50 more per month, or $600 for the year, to know that she's covered by her savings before her insurance kicks in? Remember that the most Lauren will ever have to pay in a year out of her own pocket is about the same for most plans. So to help with that question, let's move on to the cost of medical care. Thinking about her medical history, Lauren would be most concerned about visits to her doctor. Lauren would probably go to the doctor for one of two reasons: for preventative services, such as her annual physical, or to be treated for an illness like the flu or for an injury. As a runner, that's always a possibility. The good news is that preventative services are completely covered by both plans with no out-of-pocket costs. As far as visits to treat an illness or injury, Plan 1 only requires Lauren to pay $20 per visit. Plan 2, on the other hand, requires Lauren to pay the entire bill until she has met her $3,500 deductible. So if Lauren has no medical emergency, and she visits the doctor twice for non-preventative care, she will only spend $40 with Plan 1 in a year. However, with Plan 2, she may spend more than $300 for the same 2 visits. Even if she opened a health savings account with Plan 2 and used tax-free dollars, she still would be spending more. When it comes to prescription drugs, both plans require Lauren to meet her deductible before they will begin paying for them. If Lauren did have regular prescriptions, the low premium plan would be the winner, since it would fully cover them after she met her deductible. When it comes to access to doctors, Lauren doesn't have to worry about keeping her primary care doctor since she's moved to a new town and will be selecting a new one. But she does need to think about how often she will travel, back to Chicago, to visit her family, or for work. If she plans on traveling a lot, she should consider Plan 2 since doctors across the country participate in the plan. Plan 1, on the other hand, only has local D.C. area doctors who participate. Finally, let's look at how each plan covers a potential trip to the emergency room. Like with prescription drug coverage, both plans require Lauren to meet her deductible before either will pay. However, Plan 1 will cover her stay entirely after she meets her deductible. Plan 2 will only partially pay. Beyond these items, each plan offers much the same services at different levels of coverage, but most don't concern Lauren. Should, however, something catastrophic happen to her and she needs nursing home care or rehab, Plan 1 will offer her the most coverage. So what plan should Lauren choose? Let's think about her priorities again. To choose Plan 1, she should be willing to risk not having enough savings to cover her deductible. Maybe her parents could loan her the difference should something happen, and not being covered if she plans on traveling a fair amount. If she's willing to take those risks, Plan 1 is for her. It will save on her monthly premium, have the cost of her visits to her primary care doctor capped, and should something terrible happen, have almost complete coverage after she meets her deductible. So choosing a healthcare plan doesn't have to be hard if you think about your priorities first. To get to those priorities, look at your health, your finances, and who you want to treat you. By balancing those 3 things together, you can find the healthcare plan that's right for you.